trusted, credible information.
The University of Ghana Medical Center is one of the facilities currently treating COVID-19 patients. The Chief Executive Officer of the center, Dr. Darius Osei, says majority of the patients brought to the center have been discharged and only 11 remain on admission. He says the app is one of the innovations of the University of Ghana Medical Center.
It is a service. It's not supposed to be like tracking, but we are trying to define the care path from his home through to the center.
The app is yet to address the inclusion of the local languages, those with non-smartphones, commonly called YAM phones, and access for those outside Greater Accra region.
So the COVID Connect app and service is free. Residents in the Greater Accra region can immediately hook on. But for those outside the region, they have about 10 days to be part of this innovation. Reporting for GBC News, Gifty J, University of Ghana Medical Center.
To the Western North region now, where a worker with the Chirano gold mines has tested positive for COVID-19.
The Vice President and General Manager of Chirano Gold Mines, Mr. Terence Watungwa, who's been speaking with GBC News, says the patient is receiving treatment and is doing well.
He was working on that day. He did arrive on a bus, on one of the buses that comes from within our catchment area, and reported to work. And although he did not show all the classic case symptoms for COVID-19, due to the controls that we have on site that are very rigorous, we're able to detect and isolate him while waiting for confirmation, which, as you now know, came back as a positive. So we are taking further steps to prioritize the safety and health of everybody else who is working for us on site, as well as our immediate communities. Based on our travel history and study of the records, he has been a resident within the catchment area. And what we are now suspecting is that there is a possible community transmission in the area of the community where he resides. And we may end up taking further steps to further tighten our controls to exclude some parts of the catchment area going forward. But we are continuously working with the district and regional health directors. We completed a contact tracing yesterday and identified quite a significant number of people. And we collected samples for PCR testing and are still awaiting results. Further to that, we have categorized all employees and contractors who are on site into the categories of based on risk levels ranging from high, medium, low to no contacts, and based on that categorization, we'll continue forward in trying to make sure that we do the proper testing and act very quickly in protecting the health and safety for our people.
The Ashanti Regional Director of Health, Dr. Emmanuel Tinkwen, has reacted to reports of stigma against people who are fully recovered from COVID-19 in their communities.
He says this negative development will not encourage anyone to come forward for screening, testing, and treatment.
The Ashanti region has 68 confirmed coronavirus cases, with 3 deaths, 6 recoveries, 8 on admission, and 51 in isolation at home. The acting Ashanti Regional President of the Society of Private Mental and Dental Practitioners, Dr. Robert Sego, gave these statistics at a briefing in Kumasi. He spoke about measures in place to treat suspected cases in their facilities. Dr. Sego also said there are isolation centers at all private health facilities to contain the disease in the region.
We in the private sector have been working together with our colleagues in the public sector in trying to combat this invisible virus which is plaguing our society. We therefore have put in place structures to isolate suspected cases test them, and then treat at the appropriate centers.
The Ashanti Regional Director of Health, Dr. Emmanuel Tinkwine, said, with the steady rise in confirmed cases in the country, the media must intensify its education about the disease. He said discrimination and stigmatization against COVID-19 patients is a serious challenge and asked the public to stop it. Dr. Tinkwine said the lifting of the partial lockdown does not mean the fight against the pandemic is over. He said all protocols instituted by government in curbing the spread of the disease remain unchanged and therefore advised the public to strictly observe them at all times.
What we are going to do right now is to strengthen surveillance. And as part of strengthening surveillance, we've come out with certain key activities or strategies that we are going to embark on. Ashanti region and Greater Accra has been classified as a high burden region. For the whole country has been zoned. We have 4 zones. Ashanti and Greater Accra belong to zone 1, that is high burden. Then depending on the number of cases that you get, up to those regions without cases, they are the low burden. So for the high burden regions, we are going to enhance surveillance. And as part of the enhancement of the surveillance, we are going to do active contact tracing.
Some traders and drivers in the Eastern region have applauded President Akufo-Addo's decision to lift the partial lockdown on parts of the country. Their reason is that they were not able to go to Kumasi and Accra to do business. In a sharp contrast, some residents in Koforidua are living in fear as the coronavirus infection in the region has risen to 51 from the previous 40. Residents are therefore appealing to the president to lock down the hotspots in the region. They spoke to GBC News at the Koforidua Peace Protoa Lorry Station and Central Market.
Traders are back at the Koforidua Accra Peace Protoa Lorry Station. Our cameras captured food vendors and other traders doing brisk business. The chairman of the Peace Protoa Lorry Station, Mr. Yao Adogo, said the social distancing protocol imposed on vehicles to reduce the number of passengers is adversely affecting commercial vehicle drivers.
This is a confirm. Increase the fare and a number of passengers in so much so. They have 3-3. There's also 2-2. Until 9 ama scan sort pa
tama omuma we ni bae no ama hawo kakra abam na nso se na oye ne yepa ama obia na dweda ne hoso.
Some traders at the Koforidua Central Market spoke about the lifting of the partial lockdown.
Mitena efie be 2 weeks na memma na enura o lift it up no aye bae meji brodo no yankopon ya adom esan.
Mrs. I lift band no. One kasa na obehwe ohun su yie. Say ya yete anso ya kwa akire because of social distancing it. Obi beto ade a wo no wagina animu kakra. Di aso enim say ya ma social distance na o mampanyi obetumi atum.
Sesi an se na na guso ye yi na o man no so be kofom. Yesi kasem ne ye nyoma nyina. Ebe fo ne mo ki ebiedie ehumu a. Nanka bibia kos nanka obi e kɔ na djuma obi e ye na djuma asa de ye no na. Kanu mo mbe boaye.
We're back in Accra, where the Inspector General of Police, IGP, Mr. James Opon-Bueno, has directed that samples of 10,000 officers who took part in enforcing the 3 weeks partial lockdown in some parts of the country be taken and tested for coronavirus. In an earlier interview with GBC News, the Director of Public Affairs, Superintendent Sheila Kese Abeye Bachman, explained that the rationale of the large-scale testing is to identify police officers who might have come into contact with infected persons while enforcing the lockdown. She said the tests will help identify officers with the virus and get them to quickly seek treatment. Superintendent Abeye Bachman also stated that the Ghana Police Force will still be fully operational even if some of the officers have contracted COVID-19. However, she was hopeful that after the rigorous testing, the officers will turn out negative.
Up north, and the medical director at the Upper East Regional Hospital in Bolgatanga, Dr. Samuel Abura, says the first COVID-19 patient in the Upper East region, a 33-year-old pregnant woman, has tested negative after weeks of treatment at the center in Bolgatanga. Mr. Ishahaku Yakubu Adombila, a resident of Bolgatanga, capital of the Upper East region, has invented a technology to help prevent spread of the novel coronavirus pandemic in the region. Our correspondent Samuel Ayama spent some time with him and has more in this report.
The novel coronavirus pandemic is gradually destroying economies across the globe. This same pandemic is bringing out Ghanaian ingenuity. Many Ghanaians are beginning to put innovative measures in place to survive this pandemic. The material. Before I even get to speak with the inventor, let me give it a trial.
Wet your hands first. Okay, it's okay. And now you come to the soap. Step and leave, step and leave. It's okay. No, let him so that yes, okay. Do that.
Now tell us, what necessitated this move?
Thank you very much. I thank God for what God have used me to do. Like as I said, because of the COVID-19, we are supposed to wash with our hands with soap and water. And we are not supposed to be closer to each other. We are not supposed to be shaking hands. And if someone touch somewhere, you are not supposed to touch it immediately. So I think that normally where we use to wash our hands, that we can easily get it there, because someone will hold the tap or to hold where the liquid soap will be and use it before you also come and use. If the person is infected, you will also be infected. So I decided to bring this event to help the whole nation, so that they don't touch anything before they can wash their hands with soap and water. That's why I brought this machine.
Okay, thank you very much. I also have a resident in the region who also like to share with us his take on these equipment that we are all witnessing here.
Thank you very much. I think this is a fantastic, innovative and creative product that is totally different from those that are in the system. What touches me is that it appears to be an adequate response to the call for proper hand washing, and it is a product that does not use solar. It's a product that does not use electricity. It's a product that does not use battery or whatever. So it means it can be used in the urban area as well as the rural area, and it is something that human contact is minimal, because those that are in the system, you see people going to take their hands and take the soap liquid. From there they use the hands to open the tap. This one, human contact is still there. So this is something that I think, if it can completely eliminate human contact, and which is an effective way of containing and preventing the spread of this deadly pandemic called COVID-19.
Okay. The news team too, on our rounds to the various villages or the rural areas, we observed that they lack hand washing facilities, and we are of the belief that if this equipment is sent to the various villages, it will go a long way to stem the spread of the COVID-19. For GBC News, Samuel Ayama reporting.
capital, the Greater Accra Regional Minister Ni Ama Ashiti said directing the Greater Accra Regional Security Council, REGSEC, and other security agencies to enforce the compulsory wearing of face masks across the region will help slow down the spread of COVID-19. In an interview with GBC News at Tema, he said wearing of masks is especially important in public places to reduce droplet transmission of the virus.
The WHO's guidance and advice included wearing of nose masks to protect and limit the spread of the coronavirus. But there have been issues with the masks, including complaints about affordability by some. The President, Nana Akufo-Addo, also called for the compulsory wearing of the masks. Heeding to the call to stop the spreading virus, the Greater Accra Regional Security Council, under the chairmanship of the Greater Accra Regional Minister, Ni Ama Ashiti, directed that it should be mandatory for all to wear the masks, especially at public places.
That people who are not wearing face masks should not be allowed to enter into public places. We realize in some locations it's very difficult, especially in the car. I don't think the distance from between seats can be up to these 6 feet that we are talking of. So we realize that the face mask will be of importance, and therefore it was also decided that we should encourage the GPRT and other transport associations to make sure that people who board their vehicles are in masks. Otherwise, they should not pick them.
The minister called on Ghanaians to be safety conscious.
The COVID-19 pandemic is rare and it's claiming lives. We want to save our population for good work to develop our region. And therefore, it is our responsibility to protect the citizenry. In doing so, I will advise that everybody, both men, if you are in your house, even it's better while it's in there, you don't know if you are more know who has got it. We try to wear this face mask. It's not going to be forever. As soon as we are able to defeat this pandemic, it will be true. All these things will be thrown out.
On the need for social distancing, the minister directed all metropolitan, municipal and district chief executives to create alternative spaces for trading and put a ban on special market days in the region to check overcrowding. He instructed MMDAs to display no face masks, no entry notices at vantage points. Reaction was mixed about the compulsory wearing of the face masks.
Still in the capital, President Akufo-Addo joined his colleague heads of state in an ECOWAS virtual extraordinary summit on Thursday, April 23, 2020. At the first meeting held by the leaders in the STAP region since ECOWAS was hit by the coronavirus, Nana Akufo-Addo called on Africa to tailor-make its response in the fight against COVID-19 and not copy blindly methods adopted by other regions.
Africa has recorded low figures with regards to the spreading of COVID-19 pandemic. ECOWAS sub-region, as at Tuesday, April 22, 2020, has recorded in total 5,474 confirmed cases with 140 deaths. Total recovery figure was put at 1,567, while active cases stood at 3,767. Ghana was among the first in the region to be put under partial lockdown for 3 weeks and is the first to ease these restrictions. And for a full picture of what is going on in the 50 member states, the heads of state held their first ever virtual extraordinary summit on the COVID-19 pandemic. President Akufo-Addo shared the Ghanaian experience with his colleagues by emphasizing on mobilizing social forces including scientific, academic, religious, public and private sectors, which led to the limiting and stopping of the importation of the virus.
That we are led and informed at all times by science and by the data that we are able to accept. We're also learning from the experiences of governments that are of countries and governments that are further down the road in responding to the pandemic. And then finally, we think that it's also an opportunity for us to continue to push ahead with our Ghana Beyond Aid agenda. The containing of the virus has been through for us an aggressive process of tracing and testing. And so far, over 85,000 Ghanaians have been tested. We're looking to test as much as 100,000 very soon.
Also, the president called for a regional effort in finding a solution to raging virus, including a vaccine by Africans.
I think it is very, very important that we tailor a Ghanaian, specifically Ghanaian African response to the handling of this pandemic, and not necessarily copy blindly the methods that are being adopted in countries to the north of us and elsewhere. For instance, our scientists are very engaged in pushing forward the African vaccine manufacturing initiative. Indeed, there's a Ghanaian scientist is the chair of the board of those who are promoting it. We want to get to the possibility that we can produce a peculiarly African vaccine to deal with the problem, because the mutation of the virus in the various parts of the world is different.
On the matter of debt relief, President Akufo-Addo supported a proposal for 100% debt relief for Africa to mitigate the impact of the COVID-19 on African economies. Edward Nyakun reporting for GBC News.
Contributions into the COVID-19 National Trust Fund from 16 organizations on Thursday, April 23, totaled 1,394,500 cedis and $5,000. The presentation included 2 vehicles.
The Ghana Consulting Engineers Association was the first to present a check for $5,000 through their president, WDA Viala. Chemical producers of agrochemical and fertilizers also supported the fund with 100,000 Ghana cedis. Societe Generale Ghana presented a check for 500,000 Ghana cedis. Free SHS One Hot Meal Food Vendors Association had a donation of 13,000 Ghana cedis. The Ghana Union of Traders GUTA gave 50,000 Ghana cedis. The Chartered Institute of Bankers Ghana supported the fund with 30,000 Ghana cedis. ADK Consortium, a firm of architects, presented 50,000 Ghana cedis. Azar Group, producers of paint, presented 100,000 Ghana cedis. The Energy Commission gave 50,000 Ghana cedis. Pharmaceutical Society of Ghana also presented 100,000 Ghana cedis to the trust fund. Believers Love World Incorporated, a Christian organization's support was 60,000 Ghana cedis. Promasidor Ghana presented 70,000 Ghana cedis in addition to some cowbell products. The Minas Commission presented 100,000 Ghana cedis. The New Apostolic Church had 121,400 Ghana cedis for the fund. Securities and Exchange Commission Ghana presented 50,000 Ghana cedis and 200 packs of bottled water, 40 gallons of hand sanitizers and 20 Veronica buckets. The CFAO Group, an automobile company, was at the fund's office with 2 Mitsubishi L200 pickup trucks worth 300,000 Ghana cedis. The country rep, Mr. Paulo Fernandez, made a presentation. The lead trustee, Justice Sophia Akufo, received the donations and thanked organizations for supporting the fund.
Tabia Group of Companies, manufacturers of herbal medicines, has presented boxes of alcohol-based hand sanitizers and some herbal medicine to staff of the Ghana Broadcasting Corporation in Accra. The company says it will help staff to protect themselves against the coronavirus disease.
16 boxes of alcohol-based Tabia hand sanitizers, 5 boxes of Tabia malaria medicine, and a box of Tabia cleansing capsules were presented to GBC. The group chairman of Tabia Group of Companies, Mr. Christian Ajimai, acknowledged GBC's invaluable role in keeping the public informed about the coronavirus and other relevant issues. He says the gift is to protect staff of GBC who are always out on the field gathering information. He called on well-meaning organizations to do same for other media houses, as they are also recognized as frontline workers. GBC's Accra Local Union Chairman Sam Nat Kevo expressed gratitude to the group for the gesture. He was grateful that the effort of journalists in keeping the public abreast of happenings was being appreciated. He wished Tabia Group of Companies well in their endeavors.
Friends of Noguchi at Mida a group at the Millennium Challenge Authority has donated some items to the Noguchi Memorial Institute for Medical Research to support the center with its rigorous testing for the COVID-19 disease.
The Noguchi Memorial Institute for Medical Research is one of the leading research institutions in Ghana today. They were the first to work on blood samples of COVID-19 patients. Since those initial stages, the center on a daily basis works on hundreds of samples received across the country. After working on those samples, the waste generated will have to be discarded. To enable this process to be done properly, in Accra on Wednesday, some employees of the Millennium Development Authority, calling themselves Friends of Noguchi, led by its Chief Financial Officer, Mr. John Boache, presented the tricycle to the center. The group says the machine will enable the center transport the used materials, mainly waste of samples worked on, to the incinerator. The director of the Noguchi Memorial Center for Medical Research, Professor Abraham Annan, thanked the group and said the tricycle will impact positively on the operations at the lab. Professor Annan said the center is working on other projects to benefit the institution and Ghana as a whole.
Program Unit of Plan International has presented some items to the Regional Coordinating Council at WA for distribution to health facilities.
The items are Veronica bucket, soap, hand sanitizers, aqua taps, and a chemical used for treating water. The District Development Coordinator of Plan International, Mr. Kamaruddin Idrisu, said the donation was to support the fight against COVID-19. Mr. Idrisu said Plan International has already given out 130 Veronica buckets to 5 district health facilities and its operation area to promote hand washing with soap. He commended the regional epidemic management team for its efforts so far in controlling the spread of the disease in the region. The Upper West Regional Minister, Dr. Hafiz Bin Sali, described Plan International as a critical development partner. He thanked the organization for its continuous support. He said although the region needs more personal protective equipment, government alone cannot provide them. Dr. Hafiz Bin Sali encouraged other organizations to support the region to fight the virus.
Alliance for Green Revolution in Africa, AGRA, is a partnership-driven institution that is African-led and farmer-centered. The non-state actor is supporting Ghana's fight against COVID-19 by mobilizing resources to establish a seed bank and address the country's health needs. The West African head of AGRA, Mr. Foster Boateng, gave details at a media briefing in Accra.
The management of AGRA has been so much happy about what Ghana government is doing. So a couple of days ago, I was in my office when my team came to me and said, "Sir, you know that this COVID-19, everybody is making noise about health. But let me tell you that this global pandemic drives significant imperatives. And the first one is health and at the same time, agriculture. Because we need to strengthen these two systems. Otherwise, we are going to be in trouble. Considering that over 250 million people in the region, in Africa alone, can't even find food to eat. And looking at the success that we have made, if we don't do something, COVID-19 will erode everything. So this is the time that we said, let's collect action to drive the agricultural agenda. Ministry of UAID also called on me and said, can you submit to us a document to talk about how we are going to respond to COVID? I talked to them, and what they whispered to me is we are going to put 1.4 million to help you move operation in 2020. So I'm using this opportunity to call on all Ghanaians and also the media. Instead of discussing facts, things like that are not factual, let's use this opportunity to talk about convincing all Ghanaians to put at least 1 cedi into the kitty. And if every Ghanaian puts an average 1 cedi, we can raise 30 million right there, buy fertilizer and seeds and out there to plant.
Still at the media briefing, Minister for Food and Agriculture, Dr. Oswefri Yakoto, says Ghana has enough to feed the nation at this time of COVID-19. He said the Planting for Food and Jobs initiative championed by the government is yielding the desired result. He was addressing the media in Accra today.
Now that the partial lockdown has been lifted by the President, I'm here to reassure the public that there's adequate food in the country and the distribution and marketing of items will resume uninterrupted. Also, I'm here to brief you on the activities under the Planting for Food and Jobs campaign for 2020 to ensure food security in the current year and into 2021 and beyond. In view of observing social distancing, district assemblies will continue to monitor the markets to ensure adherence to COVID-19 protocols in collaboration with the Ministry of Local Government and Rural Development. At this point, I want to acknowledge the efforts made by our farmers and all actors in the agricultural value chain for their cooperation and contribution in ensuring supply of food during the lockdown period and beyond.
Residents of Changli in Tamale have petitioned the Ministry of the Interior to investigate a police raid on the community that has left some residents bedridden. Residents are also demanding a refund of their medical bills and compensation for properties destroyed during the raid. A statement signed by a community leader, Dr. Abdullahi Abdul Razak, also called for the transfer of commanders who sanctioned the raid. Our correspondent Mutala Isa has some more details.
On Saturday, April 18th, residents of Changli, a suburb of Tamale, clashed with the police during a dawn raid. About 134 persons were arrested during the raid, and a number of properties, including television sets, motorbikes, and vehicles, were vandalized in the process. Some residents were also abused, with some sustaining serious injuries. Tia Do Raymond, a tricycle operator and resident of Changli, says he was discharged from hospital yesterday and can barely walk. He narrated his ordeal to GBC News.
The police rushed me to hospital after they beat me unconscious. The police didn't come back. After they left me in the hospital, the nurses said they didn't come. Even up to date, I've not heard anything from any of the policemen who brought me or who sent me to hospital. So all the bills in the hospital is from my parents.
Abdul Rashid Musa nearly lost his eye. He said he also lost over 600 Ghana cedis during the police raid.
So I was in my room with my wife and my kids. Getting to midnight, so I was hearing my dog knocking. And I asked who is knocking the door. Nobody is mine. So that the message said I opened the door to come out. The policeman used a gun to hit my face. And they just started beating me. They beat us and sent us to the police headquarters around 3:30.
The police say no one has lodged a formal complaint about the abuse of residents of Changli. Superintendent Kobina Otua Champon is the regional crimes officer for the northern region and the acting police spokesperson for the region. He is also urging anyone who was allegedly abused in the raid to report to the police.
We were not briefed to go and attack anybody, beat anybody or steal any property. Our briefing and our attention was drawn to only go and arrest people we suspect took part in the assault of the 3 officers leading to the unconsciousness of the field male officer. So as far as we are concerned, we have not received any report of any beatings or any theft that happened. But I will just take this opportunity to encourage members of the public that if they have any grievances arising out of our operation, they have every right to take due process to seek redress.
The Northern Regional Chapter of the Ghana Journalists Association, NORSAC, a civil society organization, and now residents of Changli are all demanding a full-scale investigation into the happenings in Changli. From Tamale, Mutala Isa for GBC News.
It's GTP,
the name behind authentic and original